Hey. Hi, this is Dr. David back with the Fresh Start with Dr. David podcast. I am glad to be here today. I hope that you are glad to be here. As you know, I often talk about a lot of things that are pressing for people, even though I don't tend to jump into politics a lot, although occasionally I do. But, this is a time of transition. It's a time of transition socially and politically, but it's also a time of transition in terms of the year. And as you know, I'm a big believer in the power and energy of the seasons. So this is the season of the fall. This is late fall slash winter. And this is the time where we collect things and kind of reflect back. So this is the time of the year we also remember the things that are important, like being thankful and being grateful and looking at things in a positive way in terms of what we have and who we are instead of what we lack and who we aren't. So with that, welcome back to the Fresh Start with Dr. David podcast. I'm so proud to have our guest today. She is a renowned positive psychologist, an ICF accredited executive coach, a consultant, and the founder of Konversations with Karma. She's passionate about promoting positive psychology in the workplace and other venues in order to enhance well-being and make leaders more effective. And I think that her insights and expertise are really going to bring a lot to everybody today, especially during the holiday season. So without further ado, I'd like to welcome Karma Hill. Welcome.
Thank you for that amazing welcome, Dr. David. I'm like, oh my gosh, yes, that's me. Thank you so much. I'm excited to be here
Well,
and just have a conversation.
the first thing that I thought of when somebody asked about you being a guest is your name. So I'm a big believer in names and letters and kind of the energy associated with them. A lot of times when I have a new client to come to me, they'll have an interesting name and they don't know the meaning of it. And I'll look it up before they arrive for the visit and share that with them. And they're amazed at how well their name goes with, their life and things like that. So your name is Karma. And I believe you're the first person I've ever met with that first name. I love it, by the way.
Wow. Yeah, I haven't met a lot of other people either. I've met, I think, two people in my entire life, the same name.
Uh
And true to what you said, I feel like it
huh.
definitely speaks to my life. It fits.
Yeah.
I don't think they knew that in the beginning when the name was selected, but
Uh huh.
it definitely tracks.
And how do you think karma fits with your life?
I think I've always found that like that cause effect reciprocal energy,
Hmm.
that, the way I show up in the world also is reflective of what I'm experiencing.
Okay.
And, even as a child, the group of kids, if there was any misstep, I tended to be the one that was going to feel it and see it first. So I've
Hmm.
always kind of stayed true to what I'm putting out is what I am also, bringing in. And it's just remained always consistent throughout my life.
Awesome. I love that. I love that. That brings a lot of insight. So I'm going to start with the basics because, even though you and I have some understanding, and I'm sure yours is much greater than mine, of the definition of positive psychology, and kind of the field of positive psychology, in terms of the larger lexicon of psychology, it's kind of a newer thing. So, if you wouldn't mind, can you tell me a little bit about what is positive psychology and what is the difference between positive psychology and, let's say, general psychology?
Yeah. So, I mean, a little bit of, just the basic difference would be the study of positive psychology is looking at, human flourishing, right? Like, not that it's not important that there are things that happen in our life and that go wrong and we want to focus on those, but it takes the lens and shifts it a little bit and it says, okay, there are people that are experiencing great things in life as well, in spite of the hardships and challenges that we do experience. So, what are the things that actually help people flourish? How are they actually thriving despite, some really, tragic and hard times that many people experience? There's still more flourishing that's taking place. So the study of positive psychology is looking at, you know, how are people doing that so that we can replicate that? And that's where that scientific piece comes in, where it's not just, you know, hopeful or wishful thinking or just bringing in positive thoughts that many people may think. It's more looking at it from a scientific perspective of how can we replicate some of these same patterns and behaviors that actually allow us to flourish and thrive.
Nice. Love that. And I remember, and this is just how my mind works. I remember when I was a child and I would be really, really curious about the books on my parents' bookshelf. We always had bookshelves or bookcases. And, especially the books and things that had bright colors and things like that would grab my attention. I'd be like, oh, what's that about? And I remember there was a book or a course that my mom had on positive psychology, and it was red. And I remember, if I'm not incorrect, that it said something about, it came out or something, or was associated with like the 1960s or 1970s or 1980s. And from what I know, that's kind of the period of time in which positive psychology kind of got its birth. Is that correct to your knowledge?
Just a little bit of it. Like, I think that's where some of those foundations and principles kind of
Mm-hmm.
emerged and where people started to think about it. But as what we quote unquote a true discipline, it
Mm-hmm.
kind of came about with Martin Seligman. He was the
Okay.
president at that time of the American Psychological Association.
Uh-huh.
And he decided that, and that was in 1998, I believe, he decided that, it's important to look at, the struggles and the challenges that are associated within the psychology community, but it's more important, and he wanted to take a different lens and look at
Mm-hmm.
how people actually thriving and flourishing. So around 1998 is when it really became its own specific discipline. I think before it was just emergent philosophy
Right.
in the psychology field, but it became its own, kind of took shape and started what we know today as the science of, positive psychology.
No, absolutely. And, it's so funny because I think there's kind of a corollary in medicine. I know when I was in medical school, and I think it's starting maybe to slightly change now, but I know in medical school, the focus was always on disorders, disease, illness, and sickness, but it wasn't on health, wellness, wholeness, things like that. And that started to change. And one of the psychological principles that I kind of use to kind of guide some of the things that I do and a lot of the conversations and sessions that I have with my clients is the idea of the focal point, that whatever you get is a reflection of what you focus on. And one of the things that I like about positive psychology is it kind of begs the question that, well, if you focus on the negative things, then you may get more negative. But if you focus on the positive things, it could be the case that you get more of that. Would you agree with
Right.
that?
I definitely agree with that. And I think that that's where I was so fascinated with the approach that, Dr. Martin Seligman took on looking at, like, yeah, the disease model is there.
Mm-hmm.
It's important because it's not to negate that there are people experiencing true challenges, right? That they need that support. So the efforts need to be put there, but we don't put enough emphasis on the fact that there are ways in which people have found that help, us thrive. And that let's spend a little bit more time looking at that so we can bring more of that into our lives. And that's where some of the practices, and that's where that PERMA model, where it's looking at, his PERMA model for well-being and how do you actually create more of that. Gratitude, the more things that you find to be thankful for, the more things you find. And that's scientifically based. That's not just, anecdotal evidence. So the more that they were able to research this and really find that the science supports exactly what you're saying, the more we're finding that evident in so many people's lives. And I think that's important to really share and focus on, just as focusing on maybe some of the things that aren't working for others.
No, absolutely. And I know that both the fields of medicine and health in general, but medicine and psychology are highly, highly statistically based. And I know when I was in school or even outside of school, when they would present studies and research and trials and things like this, and they, talk about the number of patients with this disease and the number of patients with that disease, I would always find myself looking at the opposite. Well, like, okay, well, we're talking about the number, the prevalence of the incidence or whatever of, type 2 diabetes or, abnormal hemoglobin A1Cs. But why aren't we talking about the people who have great A1Cs? Wouldn't we kind of learn just as much or more from looking at those, which to me is like the opposite side of the mirror?
Absolutely. And I think that's where there's that's where a lot of missing data was, right? Where it
Mm-hmm.
was like, okay, we are focusing on these things that happen, but maybe we can take some pages out of the book from those that don't experience that. What are they doing? How can we replicate that? And how can we research and study it so that we can find ways in which we can implement all of that data into our lives as well?
Absolutely. So I'm curious. Tell me a little bit, and I love alliteration, by the way. So tell me a little bit about Conversations with Karma.
Yeah, absolutely. So, I mean, I have a coaching and consulting practice. I work with leaders in particular and organizations focused around like how do we improve our overall well-being? How do we make workplaces thriving places? And that starts with like leadership, right?
Mm-hmm.
And I think taking up more of approach of having conversations. I think sometimes it's conversational where just like you and I, you have information, I have information. The more that we can share in having that versus one person being seen as more the expert and having all the answers, I think we can collect more data and then we can use that information to actually move our organization, our relationships. We can move all of that forward. So I just believe in a conversational approach. I mean, yes, I have a ton of education, a ton of experience. I know a lot of things, but I don't proclaim to know everything. And I think that there's a lot that can be had from actually having a conversation. It lowers people's, defense mechanisms. They
Mm-hmm.
don't feel as threatened when it is we are sharing on an equal and, exchange versus the hierarchy that can sometimes happen. So, I've used the K instead of a C for conversations.
Mm-hmm.
And, my name starts with a K. So that's where that part came in.
Right. Absolutely. And so I'm going to share a little bit more about, what I read about you. I read that you have extensive experience in helping organizations create a flourishing workplace culture, that you help integrate your background with consulting work, with mental health and wellness, with executive leadership coaching and things like that in a way that helps to transform things in a sustainable way based upon evidence-based practices. So, some of the things I want to jump into today are, for instance, one topic of expertise for you that I've read was the science of well-being and leadership. So, tell me, number one, what is the science of well-being and how is that important in terms of leadership and transformation?
Yeah, I mean, I love that you're interested in that. For some, that becomes like, oh, okay, science of well-being, but really and truly, it is, falls up under that positive psychology umbrella that,
Hmm.
I talked about earlier. And it's a field of study really that just really primarily focuses on the understanding and the factors that contribute to the human happiness,
Hmm.
to our flourishing, to our well-being. So it's looking at it through the lens of how can these things be replicated. When we start to look at science, we want to know that if one person does it, are they the anomaly? Are they going to get these results, or is everybody going to experience that? So when we start looking at the science of well-being, it is how do you feel like you are showing up and you're able to flourish? Why that's particularly important, I think, in organizational spaces and with leaders is there's a ton of data that has, shown that how leaders, their well-being and how they are showing up in experience of themselves directly correlates to those that they are leading. So
Absolutely.
their direct reports, those people that are even working in tandem with them as, maybe colleagues, it all impacts everybody because energy is transferable, right? So
Absolutely.
even when I started to look at the research and study on like burnout, those leaders that are experiencing higher level of burnout are negatively impacting those that they are supervising, leading, and in charge. So it's important. So I think when we can make it a scientific, look at it through a scientific lens, we can start to take away some of the I experience this, you experience that, and we can look at, hey, here are some systematic ways in which that we can ingrain into the way in which we lead the organization, the culture that can then return pretty similar results on a consistent basis.
And let me ask you, is that one of the reasons why you think a lot of large companies started, for instance, in like the 70s and 80s and maybe even 90s, started doing corporate retreats and those kind of things, confidence building or trust building things, exercises?
Yeah, I think so, it started with looking at like, okay, maybe some people bought into it, right? Not a lot, but some. And then them talking about like, hey, here are the results we're experiencing. And sometimes I think in the earlier stages of this, people didn't necessarily know why they were experiencing it. And I think that's where the science comes in because it then helps you explain it and makes it a little bit more concrete. And as you stated earlier in the call, that, positive psychology is a newer discipline when we start to think about, true sciences. But I think that it's starting to be recognized more and more that, oh no, there is a real formula to this. This is concrete evidence that it's not just unique to a couple of different people's experiences. So I do think that that may be in part why it started working and maybe not knowing why, but knowing that, yeah, we are experiencing some benefits from corporate retreats, looking at how do we build trust with one another, kind of thinking about psychological safety, like all of those things and how they impact the leaders, employees, and ultimately how it translates into your bottom line. Like you see an improvement in revenue as a result of prioritizing well-being.
Yeah, it's interesting since you brought that up that, a lot of times, I mean, the social media world that we live in now, I mean, there was even the recent shooting of the murdering of the CEO of United Healthcare. And, they just caught that guy and they were talking about that, for instance, in the news all week long and kind of what led to that and his history. And I mean, this is a guy, the guy who did it or has been accused of it. I mean, this is a guy who was valedictorian of his high school class. He was a pretty sharp, intelligent guy. And, something happened with his back and his spine. And, here we have this. But one of the things that's always, I know when I did 3 master's degrees during medical school, and each one of them, even though they had different focuses, but each one of them went into, like, for instance, corporate accounting scandals and corporate scandals and things like that, which I found really interesting. And there are a few companies that always came up in each one of them. One was the Enron scandal. And, and there was, the Arthur and Anderson accounting scandal, which was tied to Enron and a couple others. But the funny thing about it is, like, looking back on those things and also, obviously, like, scandals like the Madoff one and the recent one with Sam Bankman-Fried. But when I look at some of those people in retrospect, of course, everything's clear in retrospect, but nevertheless, we do have studies that look at things retrospectively. But when I look back at some of those people, and their history and things like that, I always thought, like, does this person really seem like they're well? Like, do they have good well-being? Would they make a good leader? And a lot of times I came up with the answer no. And I'm just like, well, how did this person end up being the CEO? And, and it kind of dawned on me just looking at how companies hire people and things like that, just in a greater Atlanta area where a lot of people get positions and get hired based off who they know rather than what they know, that a lot of times we don't necessarily have the best track record in terms of choosing the best leaders and ones with good well-being. Would you agree with that?
I mean, I definitely do. And this is where, particularly for me, where I love working with organizations and helping to implement, you know, well-being practices within even in our hiring practices, right? The way that
Mm-hmm.
we're selecting things. I think it's important to take a total look and a holistic look at how we're showing up, who we're selecting. And I think a big part of that starts with understanding truly what the values of the company, are and what is our culture actually saying. Because a lot of times if you look at, okay, these company values state this, but then when you get in
Mm-hmm.
there and you start
Right.
talking to people, that unwritten culture is
Right.
saying something totally different. Like,
Absolutely.
some of the things that I read within that United Healthcare thing was, yeah, they do talk about the fact that they prioritize the well-being of the company as
Right.
well as those people that they're serving.
Right.
But when you dig a little deeper, they actually seem to have prided themselves on how many claims that they were able to reject, how much money they
Right.
were saving. So
Right.
then that kind of puts you in direct opposition to what they're saying versus what they're doing. And
Mhm.
that becomes a part of how they're showing up. So if really what you're valuing is saving money, the cost has to be associated with something, right? And
Mhm.
what most people are saying that they're experiencing with that company is that it's kind of been in the claims that have been approved.
Mhm.
And of course, I don't know a ton about it. I don't work for the company, but that's
Right.
just some of the what's been put out there since this has happened. But it's symbolic of a
Right.
lot of organizations, whether that's healthcare or anywhere. What many times what a company is saying that they value, what their vision and their mission statements are kind of in direct conflict and opposition to what's happening and what's showing up. And a lot of these people that are in leadership roles, they could have the potential maybe to be good leaders, but I think that there's a different lens and an approach, that we need to start to look at, whether that's, how we expressing empathy and leadership. Like you work with real people every day that have real things that are going on. Where's your emotional intelligence as a leader? And I don't think that those are key pieces that many companies are looking at holistically when they begin the hiring process. I think to your point, a lot of it is, who do you know, where have you worked? And I think they have to get really clear and focused on what are these company values that we really, really want to uphold, and how do we do that, and how are we making that part of a policy and procedure throughout. So I think that's a missing piece for a lot of organizations.
Absolutely, absolutely. And, I know even for my own, and I've talked about this because that was kind of part of the impetus for this podcast was to help people to get fresh start, but also to get a fresh start by looking at some of the mistakes of the past. And I know in my case personally, up until Obamacare came out, I had a Blue Cross Blue Shield plan that was awesome. And then after Obamacare came out and, there was the marketplace and all that kind of stuff. I know maybe the first year or two, maybe I was able to stay with Blue Cross Blue Shield, but eventually the rates rose so high with Blue Cross Blue Shield to, like $1,200 a month, $1,300, just crazy stuff. And this is way back in, 2011, 2012. And then I, I had to choose, I chose a Humana plan because it was more reminiscent of the former rate that I'd paid with Blue Cross Blue Shield before the rates started to go up. And I remember, you know, kind of thinking, you don't know, Blue Cross and Blue Shield has always been a good experience for me. And I remember my doctor prescribed me a medication. It was during a time when I was studying for my medical boards. And it was a stimulant medication to help me focus. And I remember Humana turned it down 3 times, and I provided them all this documentation and everything about, why I needed to be on this medication versus something else. And, this is after I graduated from medical school. So I knew a little bit more about stimulants and the treatment of ADD and things like that than the average person. And they turned it down. And I remember I really did not want to be on the medication that they said that I had to fail therapy with in order for me to be approved for this other medication. And lo and behold, the first day that I was on it, I ended up in the hospital with chest pain. And it was Humana. It was Humana. And I don't have any gripes or qualms about saying that. And the funny thing is I look at the Humana commercials that are on right now, and their whole standpoint about, Humana as in being more human. And I'm like, are you joking? Seriously?
Yeah,
That was my
not me
experience
further.
being in the ER and ended up with a $3,000 bill because they forced me to, or tried to force me to be on a medication, Ritalin, in fact, that I didn't think was ever a good medication before they would approve something else. And I was just like, it reminded me kind of the video that a famous doctor did, who she and her husband were both physicians, and she did this segment called Damaged Care. And it was basically about, she basically went to Congress because some patients whom she as a physician denied procedures and surgeries for ended up dying, and she couldn't deal with it anymore. And she went to Congress and was kind of like a whistleblower.
Wow, wow. I mean, yeah, we need more people like her, honestly, because it's like it's policies, procedures. It's not really looking at what's best for the person.
You
Because if
know,
we looked at what was best for the person, we would understand that, when we start approving or disapproving medications, that there are unique experiences and challenges, and that people should not be treated as a one size fit all. But hey, what are the risk factors and the underlying factors that you needed that medication for before having to almost risk your life in order to
Right.
then get it?
Right. No, absolutely. And it's also, it reminds me of kind of the introductory episodes that I did for the podcast where I basically talked about how a lot of times your motive ends up kind of guiding where you end up. And if you start off with a motive of helping people, you're probably going to end up in one place. But if your motive is to make money, then you're probably going to end up in a very different place.
Yeah, and I think a lot of times, many organizations and leaders don't quite understand that.
Mm-hmm.
And that's some of the work that I do when I come in, is helping to align the values that you set forth with the practices that you have. So if you can get really clear on your company values, where you want to go and where you want to see yourself, then we can then put those policies, those procedures, and those things in place that go, hey, this is how we show up in order to get there. But when you do it from a reverse perspective, or you look at it from a monetary, like, hey, I want to earn this amount of money,
Right.
then you can find yourself in a very different place. So that's why even in looking at goal setting, I like to make sure that, organizations and companies are looking at not just a monetary goal, but how do we want to feel at the end of this? What do we want our people to look like? What's employee engagement looking like? Like, those are all measurable markers and indicators as to where you're going, just as much as how much money you made, what was the revenue. Revenue is important, but I truly believe if we prioritize the well-being of everybody in the organization, then the revenue will come, because you'll have healthier people. Your insurance and healthcare overlay will be much lower. But when we do it at the cost of people burning out and needing to take time off
Mm-hmm.
and their mental health and that type of thing, honestly, they're spending more money. So we try to look at like turnover rate, like what's the cost of you not retaining your employees. If you can increase your retention, usually you're going to see an increased revenue. If we take that back, how do you increase retention? By looking at what are the needs of the employees. So looking at all of those things and making sure as leaders, they're prioritizing their own well-being and their health as well, because then you can make better decisions. You can show up better, and you have access to more possibilities when you can come from a healthier place. So that's the biggest focus that I try to look at. Like, hey, this can go in a number of different ways. But if you start with what is it that you truly value, what are those true values and where you want to see yourself, then you can actually put policies, procedures, and action steps in place to actually get there. So you don't find yourself somewhere like, hey, we're just looking at a bottom line and we're now costing people their health, which in turn can cost people their lives before we decide to do something different.
Absolutely. I could not have said that more concisely. And so that brings me to a nice segue. So, I think now if you compare and as somebody who was born in the 70s, my mind just kind of works about comparing the way that things were at one point to the way that they are now as I get older. But I notice, now we kind of agree now that it's important for a workplace to be creative, productive, positive, resilient, etc. But that hasn't always been the case. And I know, a long time ago, that pretty much wasn't the case. The focus wasn't on resilience or creativity or positivity. It was just on productivity. What are some of the things that you think help make a workplace culture flourish?
Yeah, so I think that's very interesting that you say that, because I as well have seen the shift throughout years, and I'm happy to see where we are. I know we have a long way to go, but I am happy to see that we are starting to prioritize it. One of the things I think is important that we look at congruency in the hiring process and
Mm-hmm.
where people are. A lot of times, as an organization, you look and say, hey, I have these roles and I need to get them filled. And they're just looking at bodies and positions, but we're not
Right.
actually looking at where are people's strengths. So
Right.
positive psychology takes a strength-based approach at looking at, how do we utilize people's strengths? Not to say that you don't improve on, as many people call weaknesses. I love to just call them opportunities for,
Right.
growth.
Growth.
But
Right.
and instead of looking at, okay, well, let's just focus on they can forcing them to get better. Where would your strengths be most utilized here in this organization? when we can start to bring people into places where they're already operating in their strengths, we tend to see that they tend to flourish in those roles, which in turn is a benefit for the company. So that's one way. When we look at like, hey, how do we give people more autonomy within the spaces that they're in? Yeah, all have a job to do. There are things that have to get done. So how can people prioritize that to where they have autonomy to be able to show up and get it done in the way that feels most aligned for them? So I talk a lot with leaders on, this notion of like, hey, let's not feel the need to micromanage, but how do we build trust? How do we make sure we're clear in the messaging that we are sharing with others? So those are just a few simple ways that, we can build more flourishing workplaces. And of course, I could go on and on and on. So, but this is a few.
Right. No, no worries. No, absolutely. I was recently I do a lot of speaking engagements, and I was recently the keynote speaker at an event called Brewing Resilience, and it was actually by a nurse leader in a greater Atlanta area, and her name is Sydney. And Sydney did this great event about brewing resilience, and she also has a podcast called You, Me, and a Cup of Tea. And some of the conversations or some of the topics that came up that were really important, and it makes sense from being a nurse leader that these are the kind of things that she wanted to be talking points for the event, was high functioning depression, high functioning anxiety, healing options. And then she also wanted to dive into hypnotherapy, but she wanted to go into high functioning depression and high functioning anxiety. And we talked a lot about that, because a lot of times people in high functioning roles or high pressure roles are the last people to ask for help. And they often seem to be the most resilient, but a lot of times they're struggling too. And a lot of people don't realize it. But it's funny, because when I thought about the conversations that she and I had about high functioning this and high functioning that, and also some of the work that you do with people in high pressure environments like healthcare, for instance, although there are many, many others, it seems to me that regardless of what environment or role that people are in, everybody seems to be burned out right now. And looking back at it kind of retrospectively, in my mind, people started to get burned out even before COVID came, and then COVID just came and ripped everything apart. Doesn't it seem like everybody's burned out these days?
Yeah, I think when I think we honestly operate in a culture within our society that kind of perpetuates that burnout. Like we
Hmm.
prioritize productivity over well-being, right?
Mm-hmm.
So even though people were already moving at a really fast pace, I mean, if you think about the differences from, the 70s and the 80s, and even being a kid, right? What was expected of you versus what's expected of, the kids now. It's like they're
Right.
entering into adulthood,
Right.
basically burned out. You can only imagine
Right.
as you continue to mount the pressures that only exacerbates where they already are.
Right.
So could not agree with you more. And then I think looking at, all of the, things that came along, COVID, the social unrest that we, are experiencing, the economic uncertainty, climate change. Like we have so many different factors that I think really do contribute to that. And we don't give ourselves or each other the amount of time and the space needed to process it. We look at building resilience, but we also have to think about, not just in the traditional form of
Mm-hmm.
resilience, but I was reading, I think it's on the Stockholm Institute of Resilience, but
Mm-hmm.
looking at something that they call like adaptive resilience, where we're
Yep.
able to project that, hey, there are some things that are coming down the pipeline, and do we have capacity in order to be able to show up for that?
Right.
And I think a lot of times the answer is no. Like no one saw COVID coming, right? So we were not prepared as an individual, as an organization, as a society to really be able to respond to that. And then on the other side of it being quote unquote ending, and it's like, okay, COVID is done, that we didn't really deal with what came of that, right? So we just was like trying to figure out business as usual. And some say back to normal. I say a new normal, but what does
Right.
new normal look like? And giving ourselves the space as a society to go, we would never be able to go back to pre-COVID because we can never undo what's been done. There is a new space that we have to operate in. What does that look like? What does that mean for each other? Where's the trauma that was experienced of all of that? I also believe we have a collective grief cycle that
Hmm.
right now that isn't necessarily being spoken, but which impacts our level of resilience and how we're able to show up and operate as well. So I think we have a lot of contributing factors that kind of are not being said, and then we're seeing the symptoms of it. And I think that does look like, depression, even at the high functioning level. There's a large increase in anxiety that's happening because people weren't able really to process, like,
Right.
what's all of this uncertainty mean for me and my life and going forward.
No, absolutely. And that brings me to kind of an important thing because people use the term burnout so much. But in your opinion, how do you notice burnout? What are some of the signs and symptoms that someone or an organization even is burned out? What do you look for when you're looking for burnout?
Yeah, so the world in I think it was 2019, the World Health
Hmm.
Organization recognized burnout as being a workplace condition. It's a three part that they kind of look at, and that's emotional exhaustion, cynicism, and
Hmm.
diminished self efficacy.
Yep.
So, and that looks different depending on, who that is. So you try to
Hmm.
say, okay, well, emotional exhaustion looks like this. But that can be where you start to look at compassion fatigue. We
Yep.
see that a lot within the medical community. They're hit hard by seeing some of the same things, and then it starts to become used to it. And the level of compassion that I have to exert starts to be energy draining. When you couple that with starting to then become cynical about it, where it's like, okay, yeah, these things happen, and I no longer have that same level of thought because it's not a anomaly anymore; it's the norm.
Right.
And then start to build into, am I doing what I once felt like I was capable of doing? Am I showing up? Am I making a difference? And you start to question yourself. So that, can start to happen within, of course, the healthcare sector has been experiencing it for a while, but
Hmm.
we're starting to see that even within education, within the
Hmm.
corporate space, which is really where I started to lean into doing my dips in the corporate sector, thinking about it there, where I don't think it gets enough recognition, where you start to see the person who was once that, new hire that everyone was so excited was coming
Hmm.
in with this breath of fresh air, the brilliance that they would
Hmm.
come in, and then you start to see that they just start to seem a little disconnected, or a little bit more mistakes are being made, or maybe they get a little testy a little quicker. They're
Hmm.
not able to communicate their thoughts as well. And some of the things that are happening, especially at a leader standpoint, is if I am put in a space to lead others, who do I stand up and share that I'm feeling all of these things,
Right.
right? Because I'm supposed to be the person that has all the answers, and that's starting to show up. So then they start to withdraw a little bit more, and then that starts to be they're questioning themselves and they're not showing up. So when you start to see those marked differences, I think it's important for those around to start to ask the questions, to start to be able to help them understand, to begin that dialogue so that they can start to figure that out. Some of the ways in which, we have started to see, because there have been several studies that have compared burnout and depression, and some of the
Hmm.
symptoms, to be honest, overlap. They seem to be pretty much the same. But one of the things that's different when you look at burnout is when those individuals are taking time and space from work,
Right.
the thing that's creating the stress, because really burnout is that unmanaged and unprocessed stress, right?
Hmm.
We all go through stress, but it's the unmanaged part of it consistently. When they step away and they take that time from work, those symptoms seem to subside. Whereas in depression, it doesn't. It kind of is wherever you are, you're experiencing some of those same things. So those are when we can start to look at true burnout. And it doesn't mean that that's the only space, because we're also starting to see that there's caregiver burnout. There are people in their personal lives. But thus far, the World Health Organization recognizes it as a workplace condition, and it's marked by those three: emotional exhaustion, cynicism, and diminished self efficacy.
Gotcha. So, what are some practical tips for people to help manage, to acknowledge, address, and manage stress, and also to reduce or prevent burnout, regardless of what kind of environment they're in? What are some basic things that everyday people can do to help manage stress and also prevent or lower burnout?
Yeah, so I think we think about, I always tell people self care is important, and
Hmm.
then helping to understand what self care really looks like. And that was a journey for me, even in my own life, was not just the
Mm.
the vacation or the massage, or even though I think all those things are amazing and I enjoy them, but it's looking at, taking a personalized approach to what is self-care for the individual. Those are some of the things that I really like to help clients dive deep into, because you need to know what actually is going to recharge and refuel you. Because when we start thinking about burnout, if we use the analogy of, your cell phone or your computer, once you see that battery going down, you can have wishful thinking, or you can kind of put something, a band-aid on top of it. It doesn't really
Right.
matter if you're not actually finding the source to charge it,
Right.
right? So you have to be able to find, like, what are those ways in which you're recharged? And that looks different for different people.
Hmm.
So one is trying to identify the stressor, right? Like, what is that thing in your life that's actually contributing to the stress? Sometimes you can do something about it, sometimes you can't. But what are you doing to make sure that you're refueling and nourishing yourself?
Hmm.
So is that having a therapist? Is that, having a coach? Is that exercising? Are you hydrating enough? Are you getting enough sleep? Do you have ways in which you know are tried and true that are going to actually be your sense of grounding? And I think a lot of times we're just so busy moving from thing to thing that we don't actually stop and honor ourselves to figure out what is it for us that's going to be the activity, the practice that's going to be nourishing and refueling. When I think about, for myself to really start to figure out, I've always known, even as a kid, I loved being outside, but I didn't actually name and identify that until about, I'd say maybe about 10 to 15 years ago, that when I spend time in nature,
Mm.
I actually feel more
Hmm.
alive. I actually feel recharged. I'm clearer. I have more creativity.
Yes.
But putting it together as a true practice. So now I know when I'm starting to feel low, the one thing for me is being out in nature, hiking, right? When I have unprocessed emotions that I need to heal, I need to then work and put a true plan in place. So I think a true understanding of what self-care is and looks like in each person's life is how they will actually be able to benefit from managing the stress. And of course, I'm always a proponent, if possible, of mitigating the stress. Like, I
Hmm.
think for far too long, we've operated in this space of, like, how do we manage it versus what can we do differently? Because
Right.
sometimes those stressors are things that we just no longer need to
Right.
carry with us. And that's where I try to help put a plan in place to actually, how do you remove that stressor in your life? We can't remove all of it, but for those things that we can, I think it's important to do that.
Absolutely. Absolutely. So we talked a little bit about what people can do to help reduce and manage stress and prevent burnout and things like that. Let's jump to another topic, and I'm going to approach this one a little bit differently, just because when I see words that are used a lot, I always say, well, let's clarify, right? Because I know, everybody now, this is just part of our lexicon, but everybody uses the word communication now, and they'll phrase it a certain way. They'll say effective communication, or they'll say the communication piece, or they'll say, this or that, or whatever. But a lot of times we fail to kind of differentiate between communication and effective communication. Of course, I want to also later link that to success in a team environment. But what's the difference between an effective communication and just a plain communication? What is it about a communication that makes it effective?
Yeah, so okay, so if we just think about communication, it's just really
Hmm.
conveying thoughts and information
Hmm.
for one another, right? It's just the process of doing that. Now, I think we've all had those conversations where you're like, I mean, I think I communicated, I shared my thoughts, and I didn't get it, right? And
Right.
it's like, okay, it didn't go anywhere. So
Exactly.
for me, when I, teach trainings and go into organizations
Hmm.
and I provide workshops on effective communication,
Hmm.
I like to think about it this way. It's that process of exchanging information and ideas so that it's clear and concise and understood by the intended audience. So
Mm.
that looks different, right?
Bingo.
So do you think about, if you're explaining a concept or a thought to a child, it's going to need to be conveyed in a different way. You need to do that based on the audience. And I think that's very important when we start looking at organizations and we start thinking about our teams. what do they need to hear? Are you providing the information for your intended audience? Not just are you sharing information? Because we could do that all day long. It's not effective communication if it is not presented in the way, in a delivery and a process in which your intended audience can actually absorb it and use it. Because
Right.
it's both, not just hearing it. What can I do with this information after I got it?
Absolutely. It's interesting. A client and friend of mine, and also a colleague of mine, recently had an appointment in my office, and we were just talking about just kind of things. And actually, even though I don't talk a lot about politics really, we were just kind of talking about the recent election, and we were, I'm an African American male, she's an African American female, even though I'm a couple of decades older than she is. We were just kind of talking about the kind of dynamics of it without getting into any real specifics. And she had this really, really insightful thing to say, because I was talking about, well, you know, this is, they broke down kind of the election, and they broke down the demographics, the percentage of African American males who voted for this person versus that, female, African American females, Hispanic, Jewish. Well, actually, I don't think they specifically did Jewish, but Hispanic, whites, Asians, et cetera, et cetera. And she made this comment, and I thought it was so brilliant and insightful. But she said that this world has never been a safe space for us. And I thought that was so brilliant, because I hadn't really looked at it from that perspective. And I was trying to understand kind of, well, why would you vote against your own interests? You know what I mean? Regardless of whether you stand, why would you vote against? And then she said that. She said, this has never really been a safe space for us. And I said, you know what? I hadn't thought about it from that perspective, but it's absolutely, absolutely true. And, I think by definition, safe spaces and safe places, regardless of whether it's the workplace or home, are places where we can flourish, thrive, be resilient, innovate, create, be productive, all those kind of things. What are some of the factors that you think allow for safety at the workplace?
Yeah, I think that's important because I'm a big proponent of psychological safety, right? I believe that
Right.
we really can't get too much done if we do not have psychologically safe workplaces. And when I say psychological safety,
Mm-hmm.
I mean the feeling of like being safe for your to take interpersonal risk, right? Where I'm
Right.
able to share with you that maybe I don't completely agree with your perspective,
Right.
or I have some ideas that I would like to share, even if I don't sit in the seat of being a decision maker.
Right.
And I think what we have to start to make sure that we put in place in order to feel like we can have a psychologically safe environment starts with trust. Do I feel like I can share my thoughts, ideas, and myself with this space and the people in it
Mm-hmm.
without fear of judgment, retaliation, discrimination? So we have to start building a space where we are included, and that means
Mm-hmm.
that maybe we look a little different, we learn a little different, our backgrounds are different, our perspectives are different.
Right.
We can challenge what's being said and done in the room with knowing that all of that is going to be appreciated, and it's going to ultimately lead to us having a more innovative, idea of a workplace. Am I able to be vulnerable in the space where I'm able to share some things that are happening? And I think that in a workplace is a perfect microcosm to be able to go, hey, yeah, we can create this by building safe place of that's underpinned by trust.
Mm-hmm.
Trust that we trust one another to be able to show up appropriately and share. Can we have effective communication? Are we able to encourage our employees to engage, knowing that anything that's shared won't be used against them, that it's just
Right.
a place to be able to share ideas and bounce them off of one another. And I think we miss that in a lot of spaces. And I think your colleague was spot on with saying that. Yeah, that's an element that's missed not only in the workplace, but it's missed for many of us in society. So therefore, we feel like we're walking around with this
Right.
mask on, and we're pushing through, which of course leads to burnout. Right? You're tired because by the time you've carried all of that around and showed up as somewhat a totally different person out in the workplace, and then you try to show up a little bit and you get rejected time and time again, it does become one of those spaces where it's like, okay, it's just not safe to be who I am. But how do you walk around every day being working against yourself and your true identity?
No, absolutely. And I can remember the first time I believe, well, it probably wasn't the first time, but it was one that really stands out for me. I remember when I was in college, I worked full time throughout college. And I remember one of the jobs that I had during college was work at a local hospital. It was called Baptist Hospital. And it was a pretty good organization in a lot of ways. It definitely had a certain culture to it, like every organization does. But I remember it was one of the first real jobs, or real, what I consider to be a real job that I had during college. And I remember the first year I worked there, when the holidays came around, they were asking, the organization was asking who was going to give to this. I can't remember what organization it was, but some organization that the hospital worked with and gave a lot of money to, and they would ask employees to do it. And I remember asking another employee about it or whatever. I was like, what is this? What is, this kind of thing or whatever? Because there was some kind of thing you could mark on this form or whatever, where part of your paycheck or whatever would go to it. And I said, I don't know anything about that. And I remember, and I was a student. I wasn't, at the time, I wasn't working as a nurse. I was working basically as a ward secretary. And I remember she said, she's like, you better mark on that form that you're giving $50 or $100 to that organization, because if you don't, you're going to be on this person's ish list. And I said, what? And I was shocked. I mean, I really, here I am, 17, 18, 19 at the time. I have no concept of that, but it was part of it. And she was being real with me about it. And I remember when my manager, the nurse manager for that unit, came to me and said, now, David, how much are you putting in for this? And I was like, oh, $100, like whatever number she said, I doubled it. And I'm like, I'm not about to lose my job because I didn't give $100 to Easter Seals or to Shriners or whoever it was. But, it really, really, it just kind of shocked me that part of my job was to do that because of the culture at that organization. But I learned really quickly. I was like, okay, I'm not about to lose my job because of $100, $200. Just take the money out.
Yeah. And those are those unspoken
Hmm.
parts of culture, because
Yeah.
when you go to read the company handbook and what they
Hmm.
say they stand for,
Right.
none of that's in there. But
Right.
it's all of that, underlying subculture that really dictates how we operate and engage in the workplace.
Absolutely. And that brings us to the last thing that I want to talk about today, or ask you for your expertise about, because this is a topic that's true and dear to my heart, something I strongly believe in. It's also something that's fairly new in terms of psychology and kind of the thought of it, the definition of it, the concept of it, and that's of self-care. And more specifically, not just self-care, but self-love and self-care. I know I've done multiple episodes on that topic, and I always say my moniker for it is that self-care is the first care, because if you don't care for yourself, you won't be in a position to care for anyone else. And I know that's one of your areas of expertise in terms of helping people to take care of themselves and to love themselves and do what they need to do so they can be stable, because it's hard to be stable for other people if you're not stable for yourself. What are some of the strategies that you recommend for people, and in terms of managing and mastering their own self-care on a regular basis?
Yeah, I think I love that question, of course, because yes, I'm all about it. That's the very first thing is self
Hmm.
care. And I think we first have to be able to identify what are our needs.
Right.
So I like to start with a needs assessment, and I
Hmm.
and I even do it for myself. So I share it with clients or
Hmm.
anybody that I'm speaking with, but I also do this practice for myself.
Yeah.
I start my days off with what is it that I need today. If you
Hmm.
think about how you show up and care for someone else,
Hmm.
I'm a parent, so I have children. I also have dogs, and I also provided end of life care for my grandmother
Hmm.
and for my aunt. And one of the things that you have to think about when you're caring for them is like you have to anticipate like what are the things
Hmm.
that they need, and it looks different from day to day. We also have to do that for ourselves. I think we get very skilled at knowing like okay, you have to make sure people are eating balanced meals, but then think about how often we neglect that for ourselves.
Right.
How do we go like skip lunch, or I had a
Mm-hmm.
lot of work, so I didn't even get to do that, or I didn't eat a healthy, nutritious meal because I had to grab something on the go and I didn't anticipate that I
Mm-hmm.
even needed to factor that in.
Yeah.
Am I hydrated? Did I drink enough water? If you think about how many times you tell, a child like, hey, they're thirsty, you're like, hey, make sure you give them water. Those are things that are important. Are you doing that for yourself? Are you getting enough rest? Are you honoring that, hey, this may be a season of grief for you? Are you showing
Right.
up and actually loving yourself and being compassionate towards yourself? We tend to show up very empathetic and compassionate for others, but then the self talk that we experience within ourselves is really harsh and critical. So I always stop to think about, hey, what do you need? What is your mental health looking like? Is there an aspect of social self care that you need? Who are those people that when you can connect with, they actually bring you back to yourself and help you really feel loved and recharged? Are there practical self care areas? How many times do we get busy and we neglect our doctor's appointments?
Mm.
Like we didn't do those annual physicals and the
Right.
things that we needed, or we knew that thing was going on with us, but we didn't address it until it became a pressing issue. When we can think back and say, that kind of started as something small a while ago, but I didn't go to the doctor and get that checked out.
I
So,
love
I,
how you. Oh, go ahead.
yeah, so no, I was just going to say, so I like to really start with that self care piece on just that foundational,
Mm-hmm.
basic level of, are you taking care of yourself the
Mm.
same way you would those in your life that you actually love? And the answer for a lot of us is no, we're not.
I love how that was brilliant. How you linked that to the foundation of a needs assessment and just kind of anticipating needs, and I'll just kind of add a caveat to that. I do couples coaching and couples therapy and things like that. And I try to do it in a fun way because, a lot of times people come with serious concerns in a relationship when they reach the point that they want to go to a couples coach or, a couples therapist or something like that. Obviously some things have hit the fan, so to speak. And I try to do it, in a fun way. And, I grew up in the 70s and 80s, and I remember Chuck Woolery in the dating game and how he took something that was, where people would be embarrassed or there were mismatches and things like that, but he made it fun. So even when there were mismatches, it was all in good fun. I usually a lot of times do that with the couples that I work with. We'll do needs assessments. And what I'll find is a lot of times each of the couples, even though they think they know each other and they've known each other for years, they have no idea what each other's needs are. And in a lot of times, one person in the relationship is giving the other person what they need, what they themselves need, and the other person is doing the same thing, and neither one of them is giving them their partner what they truly need. And it's funny the aha moments that I get just because people realize that what they need and what their partner needs are completely different things.
Yeah, absolutely. Absolutely. And I mean, you also have to factor in that, what season of life are you in? Because
Right.
sometimes those needs change, right? So if
Yes.
you don't regularly check in to do those needs assessments to see, what do I need in this season of life, because it may have looked different. And our biggest and best relationship should be with ourselves, and
Yes.
we don't do enough of that. We're so busy and so distracted that we don't make sure we prioritize that very foundational relationship of self. What's your relationship like with yourself? Because when you can know you, then you do know what you need.
Mm.
And that's where I think true self care comes in. And not to say that the other things and the fact that it's become really commercialized aren't things that can aid us in caring for ourselves. But I think we have to take it back to the very basics and say, what do I actually need, and how do I go about getting those things met in a healthy, sustainable way?
Absolutely. And that's why I love how you went to the needs assessment, because one of the things that I try to coach people into doing is, hey, what are your needs and how do you recharge them? And so you need to set up a system of regular recharges. Okay. Like, I have an iPhone, I have a laptop, I've got a charger in every room. It doesn't matter what room in my office or what room in my house I'm in. I can charge my laptop, I can charge my phone. I've got a wireless charger, I've got a wired charger, whatever. But the needs of my device are going to be met regardless of what room in my home or my office that I'm in. And I always tell people, you've got to do the same thing. Every single place that you go that takes away from your charge, you've got to have some mechanism in that same environment or a nearby environment to recharge it back up.
Absolutely. And I love how you said, a system, right? Really big on systematizing
Mm-hmm.
things. If we can make it a system, it takes less energy for us to
Yep.
get it done. It happens because when your phone is about to die, you're in a room and you can just plug it in. So if we can make sure that we're systematizing our needs and getting those things done throughout every space that we enter, then we're more likely for that to happen. And that's where to me, that's where true self-care comes in play.
This has been a incredible conversation, Karma. I'm so glad that I had the opportunity to have you as a guest expert on positive psychology, positive workplace cultures, leadership, burnout, things like that, communication skills. I love that. And I can't wait to start recommending you to organizations, healthcare organizations primarily, but organizations locally who I think would benefit from some of the knowledge and expertise. You're also working on, so tell us a little, you referenced it once. Tell us about your dissertation. So in addition to have a master's degree and some other degrees, you're finishing up your PhD. Is that correct?
That is correct. Yes, yes, yes.
Uh-huh.
In the dissertation phase, I'm
Uh-huh.
wrapping it up, but I am
Congratulations.
looking at, thank you, thank you. I am looking at how do we use positive psychology coaching as a way to mitigate burnout in leaders after the COVID-19 pandemic, right? So the landscape has changed a little. So we need to make sure that we're looking at it. So that's what my research is centered around, that there's a really high number of, burnout. There's a study, I think that was in,
Mhm.
I think it may have been in like the Harvard Business Review.
Love the Harvard Business Review.
Yeah, that said that the 82% of leaders say that they have experienced or are experiencing burnout.
Mhm.
That is an astonishing number.
Mhm.
And to look at like, hey, they're actually leading and they have people in their charge and they're not even well.
Yeah.
So, starting to think about like, how can we do that? And I just feel like positive psychology coupled with coaching. So looking at positive psychology coaching as a method to be able to really look at mitigating workplace burnout amongst leaders as a result of this post-COVID era that we're in. So that's what my study is right now. Can't wait to really dive into analyzing the results and the findings.
Yeah.
But so far, I think it's promising. So I'm excited of what's to come from that.
Awesome. Well, I would love, whenever you have an opportunity, I would love to get an article or something about your opinions about those things that I can share on one or more of my practice websites with people so that they can get a glimpse into that. That'd be awesome.
Absolutely. Absolutely. Thank you.
Yeah. So, hey, thank you so much again for being a guest. And if you wouldn't mind, for anybody who's listening, companies, individuals, people who would benefit from positive psychology, who would benefit from having an executive coach, companies, organizations, hospitals, etc., for people who can use some of your expertise and your skill sets in terms of, creating a more positive, more functional, more productive, more resilient, more flourishing environment. How can they reach you, find you, and retain your services?
Absolutely. So you can start with my website is Conversations with Karma, and Conversations is with a K.
Uh-huh.
My email address is karma@conversationswithkarma. Social media is Conversations with Karma, again, all with a K. And then I'm on LinkedIn at Karma Hill. So I'm out and about in the world. You can find me, connect, send me an email, follow, like, and I'm definitely here. So to be able to help shift the way we do business and in our workplaces.
I love that. That's one of my favorite words, shift. Love that. Hey, thank you so much for being a guest again. This has been really, really enlightening. This has been a huge, huge value to me and to the audience to understand positive psychology, to address burnout, and to help create a more positive culture, both in the workplace and away from it. Hey, thank you so much for being a guest again, Karma. Thank you.
Thank you, Dr. David, for having me, and thank you to your guests.
Absolutely. Hey, thanks, guys, for tuning in again for the Fresh Start with Dr. David podcast. Enjoy your holiday season. You will hear from me before Christmas and Hanukkah get here, but remember to take care of yourself. Self-care, self-love are so important. And also make sure that your well-being is your area of focus. Okay, take care. Bye-bye.